Good day. This is Mary Ann Schultz, your e-nurse guru, where all things electronic and digital for healthcare are discussed. Today, I want to talk to you about ChatGPT, MedPalm, and such, and I want you to try them on for size. Every healthcare provider should try them on for size. I have two parts of a webinar. One part is right now with the overview to society and how much ChatGPT is affecting many aspects of our lives. Then a little bit of drill down, still an overview of what's going on in healthcare. Part two talks more about the educational side and can be found at the website. To move on to part one, the bedside and beyond, we have two objectives for today. One is to craft one care management practice for the use of LLMs for your own practice. And another is to become conversant on ChatGPT for clinical use. First, we want to look at what happened on May 16th, given that we're starting with a societal view. And what happened there was OpenAI CEO Sam Altman and others testified before Congress on a Senate subcommittee hearing on privacy, technology, and the law. And some of the snippets from my notes are here. I guess I should admit right now, and I'm not sure I want to, that I listened to the entire 3-hour segment that you'll find at that link at the bottom of the slide, just to be sure I'm conversant today with you. But Senator, Blumenthal, quote, "This hearing begins our subcommittee's work in overseeing and illuminating AI's advanced algorithms and powerful technologies." The witnesses included Sam Altman, pictured here, also a famous professor at NYU, Gary Marcus, Christina Montgomery, Vice President and Chief Privacy and Tech Officer at IBM, where the goal of the committee was to demystify and hold accountable those new technologies and to avoid some of the mistakes of the past. Blumenthal strikes me as someone who has done his homework in regards to learning something about AI before we hear from experts who have their own language and their own authority. And his quote says it all to verify what I thought I just said, that he seems to know what he's saying. Blumenthal, ChatGPT makes mistakes and is a convincing liar. Our Sam Altman, OpenAI CEO, said, if the technology goes wrong, it can go way wrong. Some other snippets from statements from the senators include these that indicate there could be some real knowledge developing there in Washington after all. Senator Sarah Blackman, she had intelligent questions on copyright with songs, images, likenesses, and pointed out her own use of ChatGPT to Sam Altman. And there was a back and forth conversation that was almost a good playing field between the two of them, some collegial discussion. Senator Klobuchar quickly identified that the model hallucinated, meaning made stuff up, when she spoke to it. And she gave us the pointed example of asking about voter turnout and long lines being reported at the polls and where should she go to vote. She did this on a day, week, and month when there was no election in sight. But ChatGPT did tell her to go down to 123 Elm Street in her own community. So obviously it hallucinated for her as well. Senator Kennedy asked if you, Mr. Altman, would tell us in plain English what this is all about and why are you here today? Sam Altman said, I want to see a license for powerful stuff in AI that's going on and an ability to revoke the license. He's basically begging for government to regulate AI. And he had some specifics on how to do this. For my money, that's counterintuitive to see big business, and I do mean big business, like the AI business and the ChatGPT business, to be asking House of Representatives at Congress to do something about this. He also went on to say, Sam Altman did, there should be independent audits on the safety of AI. The NYU professor Marcus said safety review, like was used in the FDA for deployment of the technology, and a nimble monitoring agency with an ability to recall things, including as deployment is being tested. Lastly, that there be safe AI research. So in closing, Senator Hawley listed the problems with it: job loss, loss of privacy, manipulation of behavior, and manipulation of the manipulator, stimulating the misleading behavior. manipulation of opinion, like voting. So yes, it sounded a little self-serving at times, but this is in stark contrast to when not that many years ago, Mark Zuckerberg spoke to elected officials in Washington, and I saw that clip, kind of a long one, and there was no level playing field. What the Congress and Senate were asking him that day, he gave pointed answers and was well rehearsed, but the questions they were asking were all the wrong ones. Whereas if there's any unintended consequence, it is great news about ChatGPT, and it's this. Our legislators may have learned a little bit in the meantime. That was the clear impression I had when I walked away from viewing those 3 hours. So let's try to define our terms, and used with permission. I have the slide from Center for Digital Education, and it tells us what generative AI is. And the language is here on the left, and you can read it on your own. Category of AI. It's a learning algorithm, generates new outputs based upon the data they were trained on. So let's get out of the gate with ChatGPT was trained on all internet data, but only up to November of 21, and was not specifically trained on what's in CINAHL and PubMed and the other repositories of knowledge for nursing and medical practices, whereas the Google products were BARD and MedPalm. Unlike traditional AI systems designed to recognize patterns and make predictions, AI can create new content in the form of image, text, audio, and more. Generative AI is called generative because it can generate a response that is custom and has a context and has a human-like feel to it. And I will be recommending that everybody on the line listening now's a great time right now to reduce this window, move it off to the side, and open up OpenAI, log in, and start messing around with it. On the right-hand side of our diagram, you can see the big circle for AI, artificial intelligence in general, but where the small circle, this pinkish, ASR, automatic speech recognition, and NLP, natural language processing, means that a form of artificial intelligence can sweep a narrative and give you some conclusions, which is what generative AI is going to do. So there's an NLP side to ChatGPT. There's also a generative AI where a narrative is generated that did not exist before. And it was trained on the model. It was trained in response to your specific query. And we're going to talk about how to make queries specific through something called generative AI and prompt engineering in a moment. But this also is tangent to a circle called deep learning, a form of machine learning and AI that is resembles the human brain. So it does have a realistic feel to it. Moving on to ChatGPT, it stands for Generative Pre-trained Model and OpenAI's large language model. And those are just machine learned models that are designed to understand and process. And generative pre-trained transformers are specific types of LLMs. And it's a mouthful to say generative pre-trained transformer a couple of times. So I'm going to try not to do that. News bites. Here's what's going on. On the left, we see the countries that banned GPT very early after its release, like within maybe several weeks to 2 or 3 months. Italy, China, North Korea, Iran, Russia, Syria, Hong Kong, and Cuba. No surprises there. They are either in competition with one another, have their self-serving reasons, understandably, to be secretive in general, or otherwise not share. That does not explain all the countries there. I'm not a geopolitician, so I'll move on. But on the right-hand side, the White House called the lords of AI to the chopping block there in the White House. And those were Sundar Pichai of Google, Satya Nadella of Microsoft, our Sam Altman of OpenAI, and Dario Amodei of Anthropic. And when they summoned the lords of AI there, it was a gesture and a goodwill gesture to have a conversation about the societal good. And there seemed to be some good faith efforts there. And out of it came 2 things. One is the AI Bill of Rights from the Biden administration and a risk management framework for the same. Moving on, getting a little closer to home, tech doyens call for a pause. There was a letter, it was signed by 27,000 people in just a heartbeat of a time. And it specifically says, we call on all AI labs to immediately pause for at least 6 months. for the training of AI systems more powerful than ChatGPT 4. This pause should be public, it should be verifiable, it should be enacted, and if it can't happen, governments should step in. Well, I did not sign to make it the 27th and first person to sign, but a number of, which is neither here nor there. But the important people who did include Yashu Bengio, a professor at the University of Montreal and a pioneer in AI, an AI historian, Yuval Noah Harari, co-founder of Skype, Jean Talon, and Twitter CEO Elon Musk, the same NYU professor of that was in the congressional hearings, Gary Marcus, Peter Stone, a professor at University of Texas, and the chair of the 100-year study of AI, Imad Mustaq, founder and CEO of Stability AI, and other notable people. I would not be in favor of signing because I think it sounded anti-progress. I can't defend or refute a lot of what I'm saying. Here's its feeling that 6 months might be nothing in the scheme of things for the development of AI. The development of this particular AI, ChatGPT, took about a year, and today can be done in no time at all. For ChatGPT, the trade tool. On the right-hand side, we see the writer's strike. Here, I broadcast from Southern California, suburban Los Angeles, and over on the west side and in Hollywood, and everywhere, New York, some of Broadway went dark. The writer's strike has had a lot of reach and was in its 52nd straight day very recently. So I know that some of the demands, if you will, were that ChatGPT and large language models not be used at all. So last I looked, ChatGPT, Bard, MedPalm-2, and all those were not union members. By that, I mean, the writers do want to protect their work. And it is very clear, even to the armchair user like myself, that scripts can be written in no time at all. And you won't do without writers, but you will do with fewer of them. And that is certainly true in certain areas of medicine. And if you haven't watched what image generation and triage and what's going on there with radiology and a projection for fewer radiologists, I think you should tune in, since there are some parallels. But the writer's strike did have a clause proposed that says AI is not a human player and should not be used. I don't know that they're going to win that, but the phrase is AI is not a person, and generative AI cannot replace the duties performed by members. We'll see if they are successful. Another news bite is the godfather of AI, a famous person named Geoffrey Hinton, and I think you will detect the ambiguity in his retrospective look at his own work, which was the underpinning, a lot of it, the underpinnings of neural networks and generative AI for today. And he does speak with ambiguity about having some regrets about the early work and what it has become. Now, the headlines do say godfather of AI quits. Well, he quit because he wanted to be freer to discuss the tools that come from Google, not because there was a rift or a disagreement. So it is misleading, the headline, surprise, surprise. If you want the whole story from Professor Hinton, I would strongly recommend you look at the CBS Morning News link right there. And I found it very enjoyable and gave what I have to say and think about the future of generative AI in healthcare. It gave it a lot of context and more meaning. The other news bite that gets closer to home as we drill down towards what's going on in medicine and healthcare, the AI arms race, as it's called, Microsoft's $16 billion acquisition of Nuance. And Nuance Communication integrates GPT-4 into its Dragon ambience. And that's interesting. I generated a fake image, an artificial intelligence generated image on the right of what the clinical encounter might look like in the future. And it's this. There's a panel on the wall. I think you can see it easily enough here. And it's going to show us what ChatGPT is going to be like without the human scribe, which is fine because I see in my own life, in my own consumer history and as a patient, I've had to stand over the scribe to make sure they got it right. The systems they seem to be working from are clunky, they're not rapid. I'm being asked a lot of the same redundancy questions of the history of something. And I don't know about you, but for my money, I can't always remember the data of a surgery or a procedure. And I will, if asked repeatedly, eventually get it wrong on the medications I'm taking. I am a consumer like everybody else. And I've kind of started to wonder about the accuracy, like anyone would, when asked the same thing over and over. At any rate, Dragon Ambience is the intelligence platform to listen in to clinical conversations to generate the work of scribes. The accuracy is supposed to be very good, and end users have said that it's very, very fast. And it comes to the person who is using it, the healthcare provider who checks off on it very quickly in a matter of minutes or less. And in the old world, the prior generations or other tools, other products have been slower, leaving time for error in memory. So you can see I'm sort of for it. Now, large language models as they exist in healthcare, the future is rather promising, but I did have a little difficulty until watching many YouTube demonstrations of what exactly does this look like or feel like. And as I look right now at the sort of big picture on just healthcare industry, I have it on the screen, and it is courtesy of the medical futurist. I want you to know who that is, so you can Google him, maybe become a Patreon member of the community like myself. But he calls himself the medical futurist, right up here in the top right hand of the screen. And his name is Dr. Bertalan Meshko, or Bertalan Meshko, as pronounced in his native Hungary. He is a physician, a practicing physician with PhD in AI and machine learning. He is my ultimate authority on many things. He uses the Gartner hype cycle here to portray many different types of emerging digital healthcare trends. ChatGPT is not there yet, but other things we are familiar with are such as telehealth, digital health insurance, personal genomics services, and medication management. On the left to right axis, so the x-axis, are your expectations that rise at the beginning of hearing about, for example, ChatGPT. Oh, it's going to be wonderful. It's going to do this, that, and the other thing. All that in a bag of bread. And then we reach a peak of expectations. See here, what are our expectations? Over time, our expectations drop, and then some research comes out, whether it's published in the traditional scientific research retrievable through CINAHL and PubMed, or if it's in the gray literature. And eventually we reach a plateau of understanding what the sustainability of the model is. So if you have time or wish to pull that, I heartily recommend anything by the medical futurist. And this gives us the big picture of those emerging technologies. Today, we're discussing but one, and that's ChatGPT. And can ChatGPT-4, the version we have now, be trained to diagnose medical conditions accurately? Well, one authority, an emergency room doctor, says only if you want your patients to die. What this emergency room doctor did, and his entire spectrum of his little experiment, you can see at the reference on the website that's sideways on the screen. But what he did is take the last, say, 30 or so patients he saw in the emergency room, and he took their HPIs, a history of physical illness, history of present illness, and shoved it through ChatGPT. Now that's the version available to me, the end user, John Q. Public, right? Not the developer site and not the site that, technology that's embedded in Cerner or Epic or whatever you're using. That version, of course, has been customized to the system in which you work. But he took the version available to any of us, and if you don't have an account, get one. And he put through these HPIs and other circumstances, and he took them word for word, anonymized, of course. And he said the ChatGPT got it right about half the time. Not good enough. He went on to say that the chatbot did a decent job of bringing out common diagnoses that would not want to be missed, as long as everything he told it was really very precise. Again, the idea of prompt engineering and what are you telling or asking of ChatGPT, which I will address in a moment. He said correctly diagnosing a patient is having nursemaid's elbow, housemaid's knee, in as little as 200 words, identifying another patient's orbital wall blowout fracture in as little as 600 words, which alone is impressive. But again, the mistakes it made were sizable, 50% success rate. And here's one, even from my emergency room nursing days, which are long behind me. This is not rocket science, but ChatGPT got it wrong. It's a 21-year-old female patient, came into the ER with right lower quadrant abdominal pain. And her history, physical and so on, was fed into ChatGPT, which came up with differential diagnosis in order of appendicitis, ovarian cyst. Get real, this was a case of ectopic pregnancy, which, as we know, carries a morbidity, indeed a mortality, if missed. So we are reminded of this physician's quote to us that the art of medicine is figuring out the correct patient narrative. And I thought we were well reminded, even though there seemed to be, shall we say, some negativity to be imparted when I read the work. It wasn't a scientific work, but it was something I found in the gray literature. Now, this one is also from the medical futurist, right? And you can see that citation. All his things are, in a public format and open source. So they are asking us in this visual to look at the repetitive tasks, okay, are in the lower left quadrant and data-based in the lower right quadrant. And that those form your X and Y axes. And the takeaway message here is that digital health technologies will play a limited role and serve as auxiliary tools in geriatrics, otolaryngology, and so on. But there are repetitive tasks that are not high-risk encounters in radiology, again, in dermatology. As you've read, there are apps available where I can take a picture of a blemish on my skin and send it somewhere for a prompt back to me to help me understand, is this likely a skin cancer? And it works off what is seen by the technology and not by the naked eye as a tightening or a stretching of the skin that might go missed. So it is not replacing the dermatologist, but I am in pursuit right now of a dermatologist who would work with me on this technology, having found none yet. And on the right hand of the scale, we have professions that will be, in the bottom right, heavily dependent on digital health technologies, but medical professionals will work with them on a daily basis. Well, that's happening now in a lot of healthcare around the world, but you still need a very fine-tuned human component then in sports medicine, plastic surgery, forensics, pathology, and so on. I think what you'll also find that the medical futurist recommends to graduate practitioners, people just getting out of medical school, and I in turn say for nursing schools, to understand how is the specialty you're going to be employed in impacted by technology. That's going to be a core competency for you to understand better the digital environment that you're going into. Next, we talk about what is ChatGPT's role in healthcare. You get an administrative view here, a very nice interview, a very short one that was done at the HIMSS convention recently. HIMSS, H-I-M-S-S, Health Information Management Systems Society, of which I'm a loyal member for some time. And the responsive administrator told us a few things. One is that ChatGPT can assemble a reasonable pre-notation summary for an outpatient visit. So we're getting granular into what ChatGPT is really doing, and that ChatGPT and models like it can cut across physician and nurses' notes and make a reasonable summation with a context and a chronology that is reliable. They went on to say that millions upon millions of people signed up in the first few weeks, making this innovative technology very unlike any seen before. I will be remiss if I don't remember to say this, that this is not just an evolution, this ChatGPT, and a morphing of something that existed nicely yesterday and the day before or last year. This is not just tweaking Google search on steroids. It's much more than that. It is, in fact, a notch up. It is novel. It qualifies as an innovation, no matter what definition you're using. I use Peter Drucker's definition, new, unheard of before, and adds value to the organization. So it does qualify as novel and innovative, these large language models in healthcare. But these administrators were quite responsible when they say this depends on a few things. One is the upskilling of your staff. stressing the importance of training the medical. They didn't mention nursing in particular, but they meant it. Medical and nursing staff on what these large language models are and what kind of certainty and confidence you can place in the narrative and the summaries you read and their accuracy before you sign off on them, which should come as part of your digital training in the facility. They went on to say that there needs to be clean and high reliability in the data that's started with, and that you as the hospital administrator should start with the low-lying fruit of back office stuff that impacts the clinical encounter, and that is billing, appointment keeping, scheduling, and that's where large language models have their most value at this very minute, with the rest being tested. They went on to say that ChatGPT and AI in general will be 1,000,000 times more powerful than it is today in 10 years, and that in speaking to C-suite executives, to other executives, they said to get in now before the technology rises in price, and before long you will want an AI strategy that includes ChatGPT. You don't want to come by it by accident or after. The medical futurist then goes on to say we're living in a revolution right now. I say it's an evolution. The AI and machine learning technology in healthcare is no longer a revolt upright. It is an evolution, with ChatGPT as a notable bump up. My remarks are contained in a commentary in JONA, Journal of Nursing Administration, this summer, and I invite you to look at that. But when they say we're looking at a revolution right now, let me just point out a company I just mentioned that is already integrating, companies integrating ChatGPT, and here it is, Epic. Some of you know it to be your electronic health system, electronic medical record vendor. Cerner, another leader, has lost some ground to Epic recently. Maybe that will change, but you can see that Epic is clearly listed in the companies that are already integrating ChatGPT. For those who are having still a little bit of trouble, as I sometimes do, understanding what it looks like, it may not look any different yet in the user interface, where you as the healthcare provider, the physician or nurse, are aware that the ChatGPT is embedded yet. But you would be prompted on the screens or in your training that the summaries or the pre-summaries for the outpatient were generated in part by a large language model, and that you are in the position of fact checker and signer author. And this is done rapidly, as opposed to many days it would take to get diagnostic tests, radiologic or lab, and have them come before the human being and then be signed off on. So speed is important, but so is accuracy. And I can trade the two off, actually. If there's a long lag time in getting a result back, seems to me more of a chance of an error in use cases, in our memory of the use case, or case history, as we say in nursing. To go about as granular as I'm going to get today about what ChatGPT does for us, at the top of the list, and it comes mostly from the medical futurist, but not all of it, it's the virtual health assistant side. So the scribe, yet other things that the virtual health assistant will do, and that is to prompt the provider or the patient, that's me, that it's time to engage or go for more instruction that is custom designs at the Kaiser or the Dignity Health website, of which I could be a member. So the virtual health assistant side has helped enormously. Triage of signs and symptoms and an analysis can be done. Medication adherence, again, custom design medication instruction at websites, not just plowing through a bunch of URLs that I Googled or the Kaiser education gave to me. Another thing I can do is put some data in from the wearable and come up with some analysis of the data, including trends. By that, by those examples of medication adherence and signs and symptom analysis, we would call that precision patient education, so highly individualized education that is not for all people with heart disease, but for all people, for myself with heart disease, with a different set of risk factors than the cohort studies would indicate, because I'm not like the people in the cohort studies, I'm me. So I'm deserving of patient education that is precise to my situation, my environment, my adaptation to it. So precision patient education and precision healthcare are discussed like fist and glove when I think of ChatGPT. I can't think of one without the other. Care coordination and scheduling, some are looking askance at, but ChatGPT is going to be important in those realms as well. So if you're wondering about the take-home message here today, this is it. It's on this slide, and a little further Googling around, including looking on YouTube with those keywords, might take you to another armchair expert who can tell you in more detail what it literally looks like. Sorry. Healthcare progress with ChatGPT. I want you to make note of this. Comes from one of the Patreon community videos, chat webinars I had with the medical futurist, Dr. Bertalan Meshko, who's pictured behind the bubble. What he's trying to tell us here is that the prompt for the old GPT and the GPT-4 output and inputs have changed. And the whole concept of inputs and outputs is going to be real important. This is not like just Googling around where you would ask treatment recommendation, diabetes, and have a bunch of URLs. It's as if the large language model cut across all of them and kersplotched an answer out in front of us. And that is, what are some common treatments for diabetes type 2? And gave us an entire narrative summary. But you will want to ask it something very specific now, which GPT-4 is capable of. And it's the use case descriptor, a thumbnail. 55-year-old female, diagnosis of type 2, and A1C of 8.5%. Outline a comprehensive treatment plan, but this includes lifestyle modifications, pharmacology, and follow-up monitoring. So ChatGPT can give you all that. In the old days, not so old days, a little more than a year ago, you would have to get out some textbooks. You would have to Google around for it and plow through some websites to create that answer. And bear in mind, Jane Q. Public is able to do just this. And in the old days, people were bringing printouts of what they found on on the internet about a certain drug and asking their physician and nurse, what about this and what about this? And you had to plow through explaining that may not be for you because, and now they're bringing much more specific things that will be showing you on their phone or other device. And I say to you, prompt engineering, new concept, new term, and it means how are you asking your question? So like any other input in human interactions, I might relate to you, I had an unsatisfactory conversation with someone. You might say back to me, well, I don't know, I wasn't there. I don't know how the question was raised or the nonverbals. I don't know what the interaction was like. Well, similarly here, what you ask and how you ask it determines what you get as output. So when I put down here with a purple and an italics, what you ask is what you get. Not what you see is what you get, but what you ask is what you get, and how you ask it. I want you to just take a moment and maybe, let's see if we can pull this website up real quick. I think we can, and find out, what ChatGPT can do for us. Let me see if I can pull that quickly. So very sorry. This website tells us a lot of really specifics about how to ask the question in a manner that it can be heard by ChatGPT. And I'll summarize since it doesn't seem to want to come up. And it's this: ask ChatGPT about a use case, say your own use case, and put your age, your diagnosis, what your signs and symptoms are, and ask it to give you a differential diagnosis. But in the concept of ordinary prompts that you would give it, you speak in whole sentences, you give it a time frame that you've had signs and symptoms over the last 3 months, or that you want a 6-month life care plan for Mr. Smith, who has COPD living in Southern California. So you give it as much specifics as you can, which is a very different thing than Googling around. So what I'd like you to do is experiment with prompt engineering, where you become your own prompt engineer and speak to it in whole sentences and phrases and use industry language and jargon. When you go back to ChatGPT, now that's not any language model, it's ChatGPT in particular. I want you, when you log in, to notice that on the left side, there's a panel of your previous conversations. And what you want to do is build on that. So pull out that conversation, and you will notice that if you go deeper into the model, will iterate and continue the conversation it had with you before. And that's the beauty of ChatGPT, as opposed to Googling around, is the economy of it. Any method, of course, lacks some accuracy at some time, yet what you will get in return is a lot of detail that is customized to you. And again, of course, it has room to grow, lots of room to grow. Google and MedPalm-2 it's their product, and it did train on internet, not just the internet, but on the medical literature more deeply than ChatGPT did. I've done very little with MedPalm-2. I would rather today focus on what the basics of large language models in general are, but it's a Google upgrade for MedPalm for reliable health information. And you better know that people are going to come to you with those results. Regarding the future of AI and the future of large language models especially, there's a couple of things that I think a lot of people can agree upon. The medical futurist, myself, as well as lots of experts, regulation for adaptive algorithms in general is coming. Another is that ChatGPT and MedPalm, all of the large language models, will receive some form of regulation. Experts are saying everybody agrees there should be some regulation, but not clear what it looks like yet and what it feels like or how to go about it. Another is that specialty based AI recommendations and guidelines will come, and they are coming. And if you have not tuned in, example, ACR, American College of Radiology, has a roadmap and a set of guidelines for how to use AI in practice. And this is one specialty that has been hard hit by AI and machine learning and large language models that can generate and identify not just a narrative and text, but images. And there are predictions that there will be a need for 2/3 less of the radiologists that we are currently training. I don't know if that's true, if that was a stab in the dark, but it came from a university professor at Stanford who is himself a radiologist. So that would be a discipline I would wonder about the volume of practitioners that's going to be needed. Another prediction for the future is that there will be doomsayers. I was explaining to some young people in the office the other day what a doomsayer is. And I said, it's the people that were in the town square years ago, ringing a bell at the end of the day, week, month, or year, proclaiming doom. The end is near, okay? And so around with the sandwich board that said the end is near, the end is nigh. So the doomsday nights are out there, and that would be, in my view, the 27,000 plus people that signed up quickly to push the pause button. And there are a number of people, including high profile people in my profession, nursing, that have signed. And as I say, I did not sign and would not, and I don't believe it's going to make a difference that I did or didn't. Another generalization for the future is that AI impacts the healthcare that is provided every single day. Well, we're already there. Large language models in research. Oh, here's another nice AI generated image that I put here. Just a few words about research because they are inextricably tied to practice. Many of us would put an article and we would read it and need to read and reread it. And maybe my fatigue sets in and my cognitive ability isn't quite great for technical things. You can take and put the article in its entirety into ChatGPT and ask for a summary. So I can see some students getting a hold of this and saying, oh, good, we'll just do our annotated bibliography that way. Well, if we teach students how to use ChatGPT and other large language models and use it responsibly, maybe that's not entirely bad. I know I never said it, but there again, I just did. Part 2 of my remarks are about education. But the recommendations for research and scholarship come from someone named Warshauer. And if you have a chance, take that link at the bottom and listen to what Warshauer has to say. And they want us to understand tools like generative AI. And I cannot emphasize enough for you that the way to begin to understand it is to log in and become your own prompt engineer, play around with it. Another is to learn how to navigate the OpenAI site. It's not that hard. Prompt engineer your way and evaluate and corroborate the output, which means you are the fact checker, and to use it in authentic and ethical ways. I want you to know just a touch about what's going on with editors and manual of style. Very early in the game, JAMA came out with this, and it worried me. So I did pull the whole article and read it top to bottom, and I excerpted one quote: non-human artificial intelligence language models. This is interesting. do not qualify for authorship. Well, that's nice. I suppose I knew that before I got out of bed this morning, but that comes from Flanagan and others in the JAMA editorial board, that they do not qualify as authors being non-human. My reaction, because I embrace new technology, was, well, why ever not? I read it, and then they did go on to say, and here's how to use ethically and responsibly use large language models in the development of a manuscript. Today, when you submit a manuscript, you're often asked in the opening prompts of submission, did you use generative AI in the preparation of this manuscript? And you have a radio button, yes, no, and you might have a text box in which to describe how. On the other hand, APA, faculty are going really crazy out there about what we are going to expect of students, or are we going to ban the use of AI, large language models in our classroom? Well, good luck with that. And my feeling is I'm taking my marching orders from APA, and that's on the screen. American Psychological Association governs all matters of writing and formatting and evidencing of your work. And it says here, when prompted, and you're going to describe, what did you prompt AI to tell you? Is left brain, right brain divide real or a metaphor? End quote. So that is exactly the prompt that the author of the paper gave to ChatGPT. The ChatGPT generated text said that although two brain hemispheres are somewhat specialized, and that's a paraphrase, then a quote, was the output from ChatGPT's right here. The notation that people can be characterized as left brain, blah, 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 considered an oversimplification. And then the way to reference that is OpenAI, which is the name of the author of the site. And they tell you to put that in italics in the reference list, March 14th version. So I can tell you that March 14th version, I'm not kidding when I say what's wrong with the timestamp of what time on March 14th, because the answer I received for that prompt on March 14th late in the day will be different, I think, than the one I gave it the same prompt that morning. Nonetheless, this is what APA says, and it's very prescriptive. And I liked it because it told me exactly where to go and what to do. So if I were teaching this in the fall, I would have some sort of primer for students on how to incorporate ChatGPT into their papers, and it certainly can't write it for them. That's a myth, but that's in part 2. See if I can reduce that enough to move on. All right. Here are some research style questions. The first is, what impact do large language models have within the electronic medical record on the documentation burden? This is the question du jour, and if I could answer it, I guess I'd be up for the Nobel Prize. But nurses are leaving nursing because of the documentation burden. They're also leaving because they don't feel valued, and because they feel their license is at risk with the patient load, and because they haven't recovered from COVID and so on. But documentation burden is very real for physicians, nurses, and others. And so I want to state right up front, I want the answer, does it really help save time, and in what proportions? Next, what are the knowledge, skills, and attitudes, KSAs, of the students of the faculty in uses and abuses of ChatGPT for a short writing assignment, for any writing assignment, dissertations, and theses? And an even larger, more esoteric question, how does stigmatizing language in the electronic health record affect the model performance? Are negative stereotypes perpetuated by the nature of the training model, the data it works from, and the final resting stage of the model? I wouldn't know where to begin to answer it. My recommendations too, though, for you are to not over-rely on large language models or any other form of AI machine learning. The recommendation that I have not enacted yet is to learn to play chess, because it teaches us the language of anticipation. I might start with checkers. In either case, I would probably wash out quickly. Become your own prompt engineer again. Develop your own information literacy skills. These are at the bottom rung of the ladder of any conversation we could ever possibly have about anything electronic and anything digital in healthcare. Information literacy skills. Mine were acquired long after I graduated from whatever I graduated from. And even today, graduate preparation in nursing is lacking in teaching or developing, fostering information literacy skills. The end. decide, is this the end of the essay or traditional writing assignments? Most of us learn and evidence our learning through what we've written and what we've produced. And how has that changed? To say it hasn't changed as or won't change as a result of ChatGPT formulations is foolish. And lastly, participate in policymaking in your Department of Nursing, in your medical staff organization conversations, or wherever you work. I think I would be remiss if not saying there is a Center for AI Safety, mitigating the risk of extinction from AI. And we're talking about self-propelling and self-developing lethal weapons, that this should be a global priority along other society scale risks like pandemic and nuclear war. It's a fancy way of saying this is very serious and has the chance to gum up everything in a colossal way. So said Sam Altman, the OpenAI CEO in chief. I'm hearing a lot of noise, some of it's garbage on YouTube and in social media about AI is not better than me. AI is not going to do better than me, the physician or nurse, and so on. That's the wrong point of comparison, the wrong benchmark. The correct, so AI, man versus the machine. No, it's man with the machine, woman with the machine, versus the individual practitioner without it. So look again at what the medical futurist is telling us. AI will not replace medical professionals. However, medical professionals that use it will replace those who do not. That's a word to the wise. I have several key resource materials for the development of these webinars, and the first 4 slides are full of them. And you will be, I hope, pleased with what you have as a takeaway in these four slides that give you sources for the webinar itself. Then I broke them down in an unusual, maybe arcane way, more resources, new ones for the beginner. So if you feel you're a beginner and it's like, I graduated so long ago and I don't really know what they mean by chatbots, start with Fox, generative AI as a healthcare co-pilot. I think you'll like it. The next one is for beginners to be continued. And the last one, ChatGPT tutorial crash course. I like it. I took it. Video, resources for middlers is here, including University of California, the third notation, because I think it's some sort of, course that's being offered, I think this summer, and I think I registered for it. And for advanced beginners, I see the last one, he called himself For Beginners. Let me tell you, I witnessed that one. He's advanced. He is not the average person, okay? So I found what he had to say very useful, but it is not for the beginner. That's why I broke them down in an unusual way. I want to say also that technology, especially the language models we spoke of, it means we can deliver on the promise of true natural language understanding, and that answers to a person's questions are now going to be very custom designed, personalized to their how I use information, the level of the patient's health literacy, their digital literacy, and their entire history within the ecosystem in which they reside as a patient. So that is the good news. And the other good news, or time-honored news, I was reminded of in an academy, the American Academy of Nursing biotech, bioinformation expert panel I joined recently. Dr. Cipriano reminded us of the phrase, lastly, technology in healthcare must be envisioned, designed, tested, evaluated, and accepted by nurses, professionals everywhere. Thank you for attending. Please lean in to the large language model. I've given you a lot on how to look at phase 2 of my webinar, an overview, but focusing not on clinical like today, but with education. And I think you'll like it. And I want you to like the references. So long from Mary Ann Schultz, your e-nurse guru.